So introductions. I'll be kind of chairing the session now. My name is Ben. I'm Business Development Manager here at Thrive Tribe. We've also got Dr. Richard Pyle on the call. He's our GP and Medical Director. And we've also got Tom Shirley. He's Business Development Manager as well, and he'll be answering your questions in the chat. So wave, Richard, Tom.
Good afternoon, everyone.
Perfect. And we've got Tilly on the call as well, just for something in the tech in the background. Okay, so overview of Thrive Tribe. So welcome. So Thrive Tribe, for anyone that's not aware, is a leading healthy lifestyle provider with a proven track record. We have been chosen to deliver the new stop smoking service in City and Hackney, and the service actually started last Monday on the 1st of July. So it's a really exciting time for us to be in this space, and really happy to be in City and Hackney. Our award-winning programs focus on creating long-term habit and behaviour change programs. And so far, our impact in the world of smoking cessation is our systems have supported over 114,000 people to quit smoking, which is a fantastic achievement. Overall, Thrive Tribe's mission statement is to get 1 million people living and thriving in life. And we're really pleased to say that so far, we're well over halfway to achieving that. We've already hit the £500,000 mark, 500,000 people mark in getting to thrive. Okay, so today's session, part 1 will be delivered by Dr. Richard Pyle, going for the benefits of smoking cessation to the patient, the practice and the system. Part 2, we're coming back to myself. We'll talk about the City and Hackney smoking service, looking around the offerings to the patient, our referral routes, our eligibility criteria, and a little bit around some of our priority groups as well. Part 1 will take between 10 to 15 minutes with Richard. Part 2, maybe 50 minutes with myself, and then we'll have a nice part 3, plenty of time for Q&A at the end, and we'll try and answer as many questions as we can. But as we're going through, any questions, put them in the Q&A at the moment, and Tom will answer as we're going through, and then we'll have a bit of a dedicated time at the end as well. All right, Dr. Richard Pyle, over to you.
Thank you, Ben. Yeah, welcome everyone. My name's Richard Pyle. I'm a GP. I've been a GP for 24 years, almost a quarter of a century. And as well as being a GP partner in Hertfordshire, I'm also a certified lifestyle medicine physician and the medical director of Thrive Tribe. And I get wheeled out at the beginning of when we launch new services to talk about lifestyle medicine related and wellbeing stuff. And then my colleagues actually give you the really interesting information about how you actually access the service and all the practical stuff. But I think it's good for us to have a conversation to begin with, clinician to clinician. I understand that on this call we've got GPs, I think presumably nurses and other healthcare professionals as well on the call, pharmacists I think too. And I just wanted to talk through smoking cessation, which in some ways you might think is a little bit unsexy because we've been talking about not smoking for years. But actually I think it's really important for us to remember just where we are, how big a challenge it poses, and the huge potential benefits to patients when they do manage to give up smoking. Could I have the next slide, please? So I don't know if any of you know who this is. You could stick answers in the chat if you like. Who do you think this individual is here, lounging about on their couch? I'll give you a clue. They brought some things across from other parts of the world. They were a favourite of Queen Elizabeth. Those of you familiar with Blackadder II may recall the episode Potato, where he's very much the Queen's favourite and Blackadder is insanely jealous of him. I'm seeing what answers. We've got Drake. Someone's coming with the Drake. No, it wasn't Drake. It is in fact Sir Francis Drake. No, Sir Walter Raleigh. Sir Walter Raleigh. He introduced potatoes, he introduced tobacco, and tobacco, we should remind ourselves, is still probably, to misquote Carlsberg, the worst thing for your health. Since 1586, that was when Sir Walter came back from the colonies. This picture is apparently of his manservant who'd never seen smoking before, running into the room to throw water over him because he thought it was on fire. So it's been around a long time, over almost 500 years. And of course, the history of smoking goes back further than that. But the fact is that it's still a plague on our society in terms of health. But I think sometimes we might have taken our eye off the ball a little bit just because of all the other things that we spend our time talking about. Could I have the next slide, please? So even back in the day, it was controversial. I love the fact that in the Nicholas Monades, who I think was Spanish, translated into English, wrote this book of the tobacco and of his great virtues, and quoted as saying, good for toothache, presumably fingernails falling out, worms, lockjaw, good for your breath, apparently, interesting, and good for cancer, which I thought was, particularly interesting claim. On the other hand, King James I was not at all impressed and described it as, I love this, a custom loathsome to the eye, hateful to the nose, harmful to the brain, dangerous to the lungs, and the black stinking fume thereof, nearest resembling the horrible Stygian smoke of the pit that is bottomless. So he got properly biblical on this, didn't he? King James I, obviously not a big fan of tobacco. Now, it's fair to say it's not controversial anymore. We all know that smoking is bad for you, including people who smoke. Next slide, please. But we need to remember just how bad for us it is, because what I've tended to talk about as a lifestyle medicine physician over the last 5 to 10 years is I've been saying to people, obesity is the new smoking. Inactivity is the new smoking. But of course, smoking is still the original smoking. So when we think about the things that are bad for us, that produce, the health outcomes that we don't want, of course, it's as bad as all of those things, as any of those things, at least as bad. If you Google these things, it always makes the top 3, if not the top 1. It's been in the charts for longer than, I don't know how many of you are around. You remember Bryan Adams back in the day with Everything I Do, the theme tune to the Robin of Sherwood film. It feels like it's been at the top of the charts for absolutely decades. And of course, the problem with these hazards, the inactivity, the bad diet, the obesity, the alcohol consumption, the UV radiation, harmful chemicals at work, infections that cause cancer like human papillomavirus and hepatitis B and C, and even, of course, loneliness. Loneliness is maybe as bad for you as smoking. The problem is these aren't either or situations, are they? The reason there's an Amazon picture here is because, of course, you'll be familiar with when you go to Amazon and you buy something, at the bottom of the page it says people who bought this might also be interested in this. And of course the reality is that people, the people who smoke are not just vegetarian fell runners who do yoga all day. They are also, in fact, they're more likely to be people who are inactive, people who do have a bad diet and are obese. So you get this accumulation of multiple risk factors, of which smoking remains one. So it's just worth us remembering it isn't, we might feel it's old hat. We know that smoking prevalence has reduced thanks to our efforts as a nation, to smoking bans, to the efforts of the public health teams, etc. But the fact is that in some parts of the world, it's still a significant challenge, and that's certainly true of Hackney. Next slide, please. And in fact, before we just get on to that, in terms of Hackney statistics, I did a little bit of looking up before today. So in Hackney, we've got 29,000 adults smoking, which is 14% of the population, higher than some areas, lower than others, much higher in people who've got certain health issues or vulnerable characteristics. So, for example, in the population of people with serious mental illness, who are a target group that my colleagues will be talking to you about in a little bit, 37% of people smoke in the SMI groups. Healthwatch Hackney estimate that only about 7% of people actually routinely access smoking cessation services. That was for 2021-22 statistic. So even though there's a lot of challenge, there's a lot of deprivation, all the other risk factors in life, clearly not enough people are accessing the services yet. And I'm not saying on the call today that's your fault because you're not referring them, because I'm sure that you are having conversations with your patients, but sometimes it can feel a bit tedious bringing it up again and again, time after time, assuming maybe that it has been brought up before. But the reality is, the most telling stat perhaps, is that most people who smoke want to stop. You do meet the occasional happy smoker, let's be honest, or not even happy smokers, but I met a little old lady once who had awful peripheral vascular disease, couldn't walk more than 10 yards without getting terrible pain in her legs. And she told me that the thought of being without a cigarette terrified her more than losing her legs, which in the end she did. But they're very much in a minority. Most people want to stop smoking. And the benefits to stopping smoking, and again, I'm laboring an obvious point here, but they're really powerful. And it's just worth looking at the timescale, which I myself actually wasn't aware of back in the day before I got more of an interest in this area. But the benefits from giving up smoking range from minutes to decades. So as this is a graphic from the NHS UK's Stopping Smoking website tells you, just within minutes, your pulse rate may start to improve on stopping smoking. Within hours to a day or two, your levels of carbon monoxide go down. Within weeks, your cardiovascular system benefits, and your oxygen levels are going up within hours as well. Your breathing gets easier. Within a few months, you're noticing an improvement in your lung capacity. And that's always, of course, worth remembering, because we do get those patients, don't we, who come to us and said, oh, I don't know why I gave up smoking. I've just been coughing up rubbish ever since. But that, of course, that's because their lungs are coming back to life and the cilia are clearing all the crap off their chests that gradually will then improve. But after a year, your risk of cardiovascular disease reduces. And after 10 years, your risk of lung cancer halves. So these are all significant benefits from smoking. Could I have the next, stopping smoking, in fact. Could I have the next slide, please? And this is what I really wanted to major on. So I am a big fan of the concept of numbers needed to treat. And I talk about this all the time when it comes to the benefits of lifestyle medicine. Now, I know lifestyle medicine is a term which is debated. People can't quite agree on necessarily how to spell it, whether it should be, whether wellbeing should be hyphenated, whether lifestyle medicine is a proper thing. But in fact, lifestyle medicine is the evidence-based practice of the application of what I would call the pillars of well-being, things like movement, nutrition, connections, purpose in life and meaning, stress management, relaxation, eating well, and avoiding noxious substances like alcohol and tobacco. And it's the evidence-based application of those pillars that means we can prevent disease, we can manage and improve disease, and yes, we can reverse disease by doing these things as well. And this table is about the NNT, the numbers needed to treat. Now, forgive me for those of you who are already familiar with the concept, but just to restate it briefly, looking at medical trials can be quite boring. It can be quite uninterpretable when you look at all the stats, unless you're a bit of a statistician and you like things like p-values and talking about the power of studies and confidence intervals and that kind of stuff. But NNT is something that everyone, clinicians and non-clinicians alike, can grasp hold of. The numbers needed to treat, the number of people that you either need to offer intervention to avoid something happening that you don't want, or to have something happen that you do want. And I've traffic lighted this table because at the top of this table are things that we would regard as medical, evidence-based, and things that NICE, the National Institute for Health and Care Excellence, expect us to do so we can be good healthcare professionals. But to be honest, the numbers are rubbish. I mean, if you look at giving statins to people with a Q risk of less than 20%, so a risk of developing heart disease or stroke over the next 10 years of less than 20%, you have to treat 217 people for 5 years for one of them not to have a heart attack, a non-fatal heart attack, I should point out, and 313 not to have a stroke. And if you would like to know the source of these figures, look on the website, the nnt.com. Clopidogrel, we would give an antiplatelet drug to people who've had a stroke. Nobody would question that. Of course, I do that. But in fact, you have to give it to 200 people to prevent a recurrence and about 333 to prevent a death from a heart attack or a stroke. Gets worse. In mild hypertension, so a blood pressure of less than 160 systolic and 100 diastolic, how many lives do you save, or how many people do you have to treat to save a life? The answer is you don't. You can't. You only need to treat 12 of them, however, for someone to fall over and break something or to suffer with an acute kidney injury. And yet, as we move further down this list, we're getting into the lifestyle interventions, we're getting into starting things or stopping things, and they're so much more powerful. The Mediterranean diet for 5 years for primary prevention, so a direct comparison to statins, the NNT for preventing stroke, heart attack or death, 61. Loads better, fewer people need to take it, no one gets side effects from a Mediterranean diet, largely speaking. Smoking cessation, because today's conversation is about smoking cessation, obviously, I've put in here. And it took a little bit of interpreting, but if you read through a lot of the sort of meta-analyses, National Institute for Health, etc., the NNT comes out at about 15 to 20. So only 15 to 20 people need to give up smoking for one of them not to die. Now, I know you're thinking, well, what about the other 14 to 19 or whatever? But the reality is that they will also get other health benefits from the long-term conditions that they don't develop. But if you think about it, if you look at the drugs that we get paid to prescribe that are relatively ineffective, this NNT for giving up smoking is incredible. So it's absolutely worth doing. And if companies had a drug that would guarantee that, they'd be shouting it from the rooftops. We know that weight loss to prevent diabetes is very good. You only need to have 7 people lose a significant amount of weight. I think it's 10% or more of their initial weight to not develop diabetes. 1 in every 14 people who does that will also avoid lifelong disability. And that's got a huge cost to the system and, of course, personally to the patient as well. The stats get even better for other lifestyle medicines. And I know I'm going a bit beyond smoking cessation here, but obviously everything is connected in these conversations that we have. The modified Mediterranean diet, the SMILES trial, conducted by Professor Felice Jacka, for people with major depression, under mental health care experts, on drugs, for every 4 people that were adherent to the diet, 1 person went into remission of their depression, which is amazing. But of course, the best stats of all, and this is now the pathway to remission is now commissioned across the NHS, the intensive low-calorie diet for the remission of type 2 diabetes. If you've had diabetes for, I think, 6 years plus, it still only needs 2 people to go through the program for 1 to reverse or put into remission their diabetes. And if you're newly diagnosed within the last year or 2, it's a 1-to-1 ratio. You can turn your disease around. So again, the point I want to emphasize in all of this is that it may not be new, it may not be sexy, smoking's been around for ages, it is harder to crack. There are people now who you could argue are slightly tougher nuts. The low-hanging fruit has been picked. But my colleagues in a moment or so are going to talk about the groups, therefore, that we really should be prioritizing, and the groups that I would strongly encourage all of you in your day jobs, whether you're in a GP consultation, whether you're running a clinic as a healthcare assistant, whether you're a pharmacist giving advice to your patients, whether you're a health coach working for your PCN, it is absolutely still worth bringing up smoking and then talking about the services that are available to help support people who want to. And that's it from me. So I'm going to hand over to my colleagues who are going to talk a bit about the service itself, how you access it, etc. Thank you.
Brilliant. Thank you, Richard. Okay, on to part 2. We're going to start to introduce your new stop smoking service. Okay, so what is the program and what is the offering to the patients? So as we mentioned earlier, the service went live on the 1st of July, so last week, so we're now an active service. Next slide, please, Tilly. And our service is called Glowgy Smokefree City in Hackney. Now, Glowgy, we'll see quite a bit throughout the next couple of slides. Glowgy is our brand name. So Glowgy Smokefree City in Hackney. Who's the service for? So we're looking for any adult or anyone who's over 12 years who live, work, study, or have a GP in the Borough of Hackney or the City of London Corporation. Glowgy Smokefree City in Hackney, our programme is a 12-week programme, and it combines science with psychology. And we offer quit aids, pharmacotherapy, NRT, for example, patches, gum, delivered to the patient's door. So support includes fully trained NCSCT stop smoking advisors and mentors, and the 12 weeks of interactive videos, online articles, tips, tricks, and guides to support them on their stop smoking journey. We're working with those in the healthcare professional area, and our overall goal is to reduce the number of smokers in City and Hackney. Okay, so how does it work? Our support options. All clients can choose to speak to their stop smoking advisor, either person or remotely. So what will happen is when you signpost someone to our service, they'll come to our central triage team, and from there they'll be given a choice. It's very person-centered. They can say, right, would you like face-to-face support? In which case they'll be offered one-to-one face-to-face appointments with a fully trained stop smoking mentor, and that'll either be within local pharmacies, that could be in GP clinics, or that could be in our community centres. They'll then get access to pharmacotherapy, including free NRT, and also options for e-cigarettes or vapes. They'll have regular check-in sessions to keep track of their progress. We can look at behaviour change techniques and make sure that the patient is motivated along their journey. And the key thing as well is understanding support. So all our mentors and advisors know how hard it can be to quit smoking, and they're really good at working with our service users and patients. So that's option one, is the face-to-face route. It might be a case that that's not ideal for everybody, so we do have a remote telephone support option. And again, if someone chooses that, they'll get flexible one-to-one telephone calls at a time that suits them. So we know everyone's got busy lives, hectic schedules, so it could be an evening or a weekend call that's most appropriate, and we'll work with them at triage to see, okay, what times and days suit you best for your telephone call. The same access to pharmacotherapy and NRT and vapes will be provided. And again, the intervention of the regular telephone calls to keep track and keep motivated and progress along the 12-week step-down program, that'll be the same as it will be face-to-face. And again, all our telephone advisors are qualified and again, very friendly and empathetic to quitting smoking. As well as that, so whether it be face-to-face or telephone appointments, everyone gets access to our digital offering. So all clients accessing face-to-face and remote support get access to Glowgy's digital web app. So this is 12 weeks of digital content to support them along their quit journey. So there's a few nice examples at the bottom there. You can see where Glowgy kind of comes in with our branding, and that kind of correlates very nicely with our Glowgy Smokefree City Hackney brand name. They'll get 12 weeks of interactive stop smoking videos. They'll also get online articles, tips, tricks about cravings, how to crush the habit. They'll also get a nice quit journal, which you can see in the green at the bottom there. They can track their progress. There's some really nice content there on triggers as well. As well as that, you'll also get access to our online gym, which again, it's a Glowgy gym, and on there are hundreds of pre-recorded exercise videos. Everything from low intensity chair-based, cardiovascular exercises, strength training, and a bit of HIIT training. So, you know, as Richard mentioned, if someone's smoking, they might possibly have a little bit of weight to lose, they might be more physically active, or it might be a case to support their triggers. They might want to do some exercise alongside quitting smoking. So we have all these exercise videos available as well. And our Glowgy web also has access to recipes. So they have a recipe book they can access along the journey as well. Okay, how do we refer into Glowgy Smokefree City and Hackney? So option one is your clinical operating system. So as of last week, we are now on EMIS, which I believe is what's used in Hackney and City. The referral form is exactly as it was before. You click your button on EMIS, and all we've done is we've swapped out the previous provider's referral form and we've input our own. So there should be no change on your operating system. That'll go straight into our referral inbox, secure NHS mail, and they'll come to our team ready for triage. Option two, you can submit a referral through our website. So if you go on a website, which we'll put on in a couple of minutes, you can download the referral form. And again, that can be sent directly to our NHS mailbox. Our NHS mailbox is tt1.smokefreecityandhackney@nhs.net. And we'll put that on the screen at the end so everyone can make a note of that. And again, same thing happens, it comes through to our triage. Option three, patients can self-refer. So they can come onto our website, there's a big button at the top, call to action, get started, and they can fill out a simple referral form and they can refer themselves into our service. There'll be a few questions around our criteria for joining, but they'll come to the same process, whether they're from a GP, a healthcare professional, or self-referring. Everyone comes through into our central triage, and we have that service user conversation about how do you want to access service, face-to-face or remotely. Next slide, please, Tilly. Okay, seamlessly now into eligibility. What's our inclusion and our exclusion criteria? So to be eligible for our service, they have to be aged 12 or older. They have to live, work, study, or have a GP in the City of London or in Hackney. And they have to be a current user of a tobacco product as well. So smoking or cigars, shisha, anything like that, with actually having tobacco, that makes them eligible. And we also want to be motivated to quit as well. It should be their choice to, right, now's the time I want to start to quit smoking. So we want to be that ready change kind of moment. And in which case they'll be willing to commit to special support through our service. Okay, who's not included? What are our exclusion criteria? Obviously, it's 12 and above to come to our service. So anybody under the age of 12, unfortunately, we can't accept in our service. There are also a few cautionary groups, particularly based around pharmacotherapy. So between the ages of 12 and 17, some things are less appropriate. Same with those that are pregnant or breastfeeding. If someone's got any kind of cardiovascular disorder, we will kind of go through what's suitable to prescribe and what's not suitable for them to use. And that's all based on NICE guidance and discretion. Working together, okay. So how can we make City and Hackney smoke-free? That's our overall goal. So with our contract, we are a universal offer, so anybody that's eligible and is smoking can come to our service and we will help them to quit smoking. But as Richard mentioned, there are a few priority groups where we know that smoking prevalence is a bit higher, or that they might have a few barriers in engaging with quitting smoking. So we have got some priority groups. So as you can see on the screen here, those from socio-economically deprived communities, particularly those pockets where we know there's IMD1 areas of deprivation. That's where we think, okay, there might be slightly higher prevalence of smoking there, so we can work with those. That applies for those in routine and manual jobs as well. Smoking prevalence is again slightly higher, so that's something we're going to try and target that with bespoke pathways. And as Richard mentioned, those living with poor mental health. So we're going to have a pathway working with that. Long-term health conditions. So if someone's also got comorbidities or contributing factors, we know smoking can be more dangerous, so we're trying to prioritize that. Pregnant ladies, we want to try and get to quit smoking as soon as possible. And we also know that those from the LGBTQIA+ community are also less likely to engage with stop smoking services, as well as people experiencing homelessness and people with substance misuse. So that they are kind of our priority groups. And we also have some majority groups we want to try and target as well. So these are a few demographics within City and Hackney where we know that smoking prevalence is a bit higher and they're less likely to engage in our services. So they include the Turkish, Kurdish and Cypriot communities, those from Black Caribbean or mixed white Caribbean backgrounds, Bangladeshi, Eastern European, and those from Vietnamese backgrounds as well. So what we've done, we've already started work on co-production. So the service went live last week, and we use I said co-production. If anyone's not sure what co-production is, it's a term that we use quite a lot in Thrive Tribe. It's been more and more apparent in the NHS and social care in the last 5 to 6 years, and it's more of a way of working. So what we do with co-production is we get representatives from the demographic we're trying to target or from that priority group, and that could be service users, ex-service users, those with lived experience, charities, organisations, and we sit everyone around on a table on a nice equal footing, and we say, right, the goal is we want this project group to quit smoking. What is the best way to get from here to there? Are there any barriers we can overcome? Can we design the intervention slightly differently? Is it a case that we need to look at dates, times, locations? What can we do to make sure that for that project group we're more accessible? And that's working in a very co-productive and co-designing approach. And that's already started. So last week we've started a focus group with the Turkish, Kurdish and Cypriot communities to discuss just that. And then our team, which we started now, we'll start rolling through these project groups one at a time and get some bespoke interventions and some real key insight into how we can best work to quit smoking. Okay, where is your nearest clinic? Okay, I'm going to take control of the screen now. Okay, that should now swap over to a nice map. We can see at the top there in the blue, Hackney, at the bottom, City of London. This is a nice example of where we will be delivering. So we are working with pharmacies in all those locations that have got the yellow pin on. At the moment, these pharmacies have got NCSC2 advisors, so they're trained in stop smoking. And what we've done, we've agreed a tariff with the pharmacies. So it'll be the pharmacies trained staff delivering as a subcontractor for Globally Smoke-Free City and Hackney. Now, this is an initial plan where we've got some agreed locations. If there are any pharmacies or pharmacy managers on the call that would like to join us, we'd absolutely love that. We'd love to hear from you. So in a minute, I'll put my NHS mail on the screen so you can contact me. These are where we have trained advisors. for any pharmacies that don't have trained advisors, we are able to offer training, and we can come in and train up to the nationally recognised NCSCT level 2. So that can be something we can build in down the line. We've got GP provision. We've got nice pink dots, and that's where our trained advisors will be coming in to GPs and using some clinic space there. Again, that's a nice trusted location, so we get a lot of sites and referrals wanting to come to a GP space. Again, if there's any practice managers on the call or GPs that think that we're not in your centres, it's fantastic for your QoF points, and we'd love to hear from you, and we can put a clinic in your space. And then in the orange, we've got a few community clinics as well. So across pharmacies, GPs, and working in the community, we've got a really nice set of where we're delivering. And this will only grow as our service expands more and more. Tilly, I'll pass back to you now. Perfect. So that's a nice map of where we're available. And then Tom, if you can please just whack in my NHS mail address in the chat, by all means, reach out to me. We can have a conversation about working in your space. Marketing materials. Okay, so now we know where we're based. How can we market ourselves? As you can see there, it's a really nice example of one of our flyers. At the top, we've got Glogy Smokefree City Hackney, so it matches all our branding in terms of our Glogy web app. Really nice, clean and accessible, easy to read format. At the bottom there, we've got a few of our call to actions. They can call us, email address, visit on the website, or for anyone that's tech savvy, we've got a nice QR code there. They can scan that, and that'll come directly to our website, and they can sign up. On the reverse, we've got our criteria for who's eligible, how to join up, and a bit of an overview of the 12-week program. So with that, we have got resources available. We've got flyers, posters. Please put a link in the chat now so you can actually get and access those. But likewise, if you'd like to do a more bespoke campaign, for example, we can do text or email campaigns, letter campaigns to those that you identify in your practices that might be smokers. So we can make it more bespoke if you like. Just please do reach out to us. Okay, what happens next? Refer, refer, refer. So we're now live, and yeah, we're delivering. So please do refer patients into us, and we'll get them booked in an appointment as soon as possible. Let us know if you wish to have as a host in your centre. So it could be, let's say, a pharmacy, it could be a GP. If there's any community spaces on the call today, we'd love to work in the community as well. Again, do reach out to us, and we'd love to be involved. So yeah, absolutely get in touch. And there's our contact details. So we've got phone number. Our general inquiries email address is cityandhackney@glogy.co.uk. Then we've got our referrals email address, which is direct NHS mail. And then we've got our website as well. I'm going to hand it over to Tom now for any questions.
Thanks, Ben. Just as a start point, I've not been able to find your NHS email address, so if you don't mind dropping that in, that would be great. We've had a few questions coming through, so thank you to those who've been asking already. I'll just touch on those that have come through for those that haven't been able to follow in the chat. So the first question we had was if there were any issues regarding the service and Quick Manager, what's the best way to contact us? Ben has just shared the contact details on the site, but you can email cityandhackney@glogy.co.uk, or you can call us on 0800 054 1190. In terms of payments for those pharmacies that are working with us, they're going to be monthly. So there was a communication sent out last week, which hopefully people will have received. If you haven't, then again, please do get in touch, and we can get that across to you. And for those pharmacies that aren't already delivering with us, then again, please get in touch, and we can work out how we can best work with you. What was the next one we've got? There was a question about how we get staff accredited to provide the level 2 stop smoking service. So we will be running training programs to train new advisors, get people to NCSCT level 2 for stop smoking practitioners. And then there'll also be refresher sessions as well for those who are already delivering at that level, just to provide latest information in relation to stop smoking services. There's a question about whether contact details will be available through Quit Manager, and we'll be speaking to the IT team to make sure that they are added. They're also being added to our GP referral form, so people will be able to get hold of us and contact us. But we're planning to be very present in the community. We're going to have an engagement team. We'll have a healthcare engagement lead coming on board, and hopefully these people will be very much present. So contact details shouldn't be too hard to find once we get going. Next question was how we're going to advertise the service to the public, and which pharmacy and how we're going to advertise which pharmacies the service is available from. We've got a full marketing plan. So as I mentioned, we'll have an engagement team, and we'll also have a range of digital and face-to-face marketing methods, which will make it clear that the service is available. We'll also have the community pharmacies listed on the website, and similar to the map that Ben shared, residents and clients who want to come on board and get into a pharmacy will be able to access the website and see the location of the pharmacies that are delivering. In terms of pharmacies, in terms of vapes, there's a question about who provides vapes and what sort will be allowed. We'll have swap to stop resources, which are going to be made available to distribute e-cigarettes. So there'll be a voucher system. Majority of the service will use Scope S from Totally Wicked. However, mental health service users will receive a closed pod system, which will come to a very similar voucher-based system. There was a question about where marketing materials can be ordered from, which Tilly's very kindly put the link into the chat. So please do have a look there, and you'll be able to see where you can order your marketing materials from. If you just fill in that form, there's an opportunity to get digital and printed resources, and we can get them out to you as soon as you can. Let's find the next question. Can GPs refer into the community pharmacies directly to us in the community pharmacies? So GPs will refer to the service. So anybody accessing the service will come through those referral forms that Ben's outlined before. They'll come to our triage team, and our triage team will be able to refer directly into the routes. So as we mentioned, the service is very much based around client choice, and we want people to be able to access the need in the service in the way that their needs require best. If that's going to be coming to the pharmacy, then we'll be able to refer them directly back out to the community pharmacies. If not, it will either be that face-to-face or remote clinic. Pharmacy providing service for a long time but not listed and already has NCSCT certification. We'd love to hear from you. So as Ben's talked through, he'll drop his contact details and his NHS email into the chat. And if you can give us a message, drop us an email, and we'll arrange a call with you to come and organise coming to speak about how we can deliver in your pharmacy or how we can work with you in your pharmacy. There's the question about the marketing material form. Tilly's again put the contact details in. We're still using Quit Manager. We absolutely are. So we've been able to organise a continuation of the service. So Quit Manager for those pharmacies who have signed up to work with us, it should just continue. It's the same username and the same password. So as before, if you're already signed up, fantastic. We're really looking forward to working with you. If you haven't but would like to, then please do get in touch, and we can organise getting that continuation as easily as smoothly as possible. Question about what marketing materials that we can hand out that are bespoke to community pharmacies. So that's something that we can speak to our marketing team about. We do have a range of materials, and if you complete the form that we've put in, then we can organise getting them to you. And I can have a conversation with our marketing team about how that looks for bespoke community pharmacy delivery. And how will the triage team refer to the pharmacies? How will that work for us? So basically, GPs, as we said before, will refer directly into the core service. So when we triage the individual, if they opt for pharmacy activity, we'll signpost that person to the pharmacies. So yeah, they'll come to you directly as a result of being triaged from our service. So let's have a look. What's the next question? Are we going to have any SLA for the service? Absolutely. So we have got, as Ben showed, a range of pharmacies already signed up to the SLA. And we can absolutely have a conversation about sending that out and going through that with yourself. Next question. How will referral and/or patients quit status be fed back to GPs? So that's something that we need to work on, and Amaya, perhaps we can have a conversation about that following up on this meeting. It's something we're experienced at doing in terms of sending data back, and it's something we can have a conversation with yourself and with the commissioners about. So bear with us, and we'll have that conversation with you. That is all the questions that have come through currently. So I'll hold on for any more that come through. Let's have a look. Yeah, that's everything that's come through at the moment. So as I say, we'll hold on for another couple of minutes. But if not, Ben, I think we can start to think about wrapping up.
That's it. So thank you for joining us. If you have any questions, you've got our email addresses, or feel free to the chat now. We can come back to you. But yeah, we hope to see you very soon. Thank you very much. And thank you, Richard, and thank you, Tom, as well, and Tilly for doing our tech in the background.
Thanks, Ben. Thanks everyone.
Cheers.